Tukaj ob meni je Sara. I will just do the introduction in my language. Vprašala sem jo, če lahko za vse vas pove, ker glede na to, da je manualna terapeutka in dela enako kot jaz, za koga so vse te stvari. So I just told them that I will ask you for who exactly the manual therapy you and I are doing is for, and how can people recognize themselves so they can seek our help.
Loving all the classes, the modalities. I see a lot of patients with just normal office job. I have pain here. I cannot take a deep breath. Or I have migraines. All of these with just a few techniques to lessen the load in the organs, helps them to open up on the inside. People with chronic low back problem or chronic shoulder problem. What do something can go all the way down and have an effect? One thing, my tailbone technique, it released a chronic shoulder problem. One session, there was another patient, very achy back. Oh, I don't know. We work on it for 1 whole year. Other issues, but that backache is still there. One session, the PT, the physical therapist, unhooked something of the heart ligament. So the other side affected the back. We asked a month later, oh yeah, what happened to that back pain? What back pain? Oh, that, gone. So very small things, sometimes daily things, ache here, breathing, popping up the air. 1 or 2 techniques, it allows us to open up. So this is for anyone, any age. I want to get more into how this work can affect dementia, Alzheimer's. Very many, it's not just for the person. Maybe you cannot end progress of dementia, but the family members, the ones who are to take care of them. Why should we just give them up to nursing homes and saying hi, and they forget whatever, but the less stress of family members to deal with these.
Yes, because this work can actually release the symptoms. We cannot reverse the illness, but we can influence the specific symptoms that are bothering people that have dementia, as you said, right? Yeah, that's the brain work.
Yeah.
And especially organs are so much for the blood flow, for the cognitive capabilities.
Yes.
And for any kind of pain in the torso, actually, right? Would you say you see, since you mentioned tailbone, also the pelvic floor disorders?
Oh, yes. Women's health.
Yeah.
Even in the U.S. Oh, you're this age? It's okay. It's part of life. Live with it. You're pregnant. I have something pushing on my rib, my wrist pain. Oh, it comes with pregnancy. Live with it. Doctors only spend 2 weeks of med school dealing with menopause. Deal with it is what? Because they don't have, unless you want to take drugs after drugs for the symptoms. But internally, you start earlier to let the blood flow, let all the organs communicate. And the spinal fluid being affected, then nice flush all the time.
And also the menopause and the liver, it's so connected. Think about it. So hormones and the intestinal region, we have to do this in order to stay more balanced, right?
Yes. To know about it, educate yourself, have someone do the techniques on you too, and then you can self-care.
That's all that matters. That's what we do. Give me 5 seconds. Bye.